I think we're fine. I don't know. Hey, hi, this is Marilyn Harris Davis, and you are listening to Urban Health Beat 2.0, the podcast. I am your host, and I am joined by
Dr. Garry Jennings,
I have
the
to,
host.
I have to nudge him because, anyway, Urban Health Beat is a show that speaks to your spiritual health.
Mm-hmm. Feed your mind, body, and your spirit.
Absolutely, absolutely. We are so joined today by an amazing, oh my gosh, I've been trying to get this woman on my show for so many years. I got to tell you, we're joined by, and just stay with me, Dr. Helen Holton. Okay? Stay with me on this introduction because you all need to know what an amazing woman she is. And I'm reading this. Dr. Helen Holton, a retired member of the Baltimore City Council, after 21 years of service, continues to impact the lives as the dynamic leader of the National Organization of Black County Officials, which we all know is very, very important. Black County Officials is an engaging organization, and Dr. Holton is a speaker, trainer, and credentialed leader and coach. She works with leaders who want to achieve more success, more joy, and a deeper person in life. By the way, I don't know if I've said this to you before, but she's also a minister. She is, she really is, and that's important. Tested and tried more than once, she keeps bouncing back, better than ever. Because you know how politics is, but I'm going to tell you, God called her back. God called her the ministry. As the leader of social justice advocacy efforts for NOBCO, which is the National Organization of Black County Officials.
NOBCO, for sure.
NOBCO, absolutely. In matters of health and health care, criminal justice reform, and technology's digital divide, which is huge, Dr. Helen, I'm going to call you Dr. Helen, committed to empowering leaders to become their best. She's a trusted sounding board. And I have to tell you, she has been my sounding board, advisor, and certified strength coach to executives, entrepreneurs, and emerging leaders. So we'll give you the information. For more information, you can call or text DRHELENHOLTON.com. So, but we'll get that back to you.
Dr. Helen Holton.
DrHelenHolton.com. So, Dr. Holton, welcome. Oh my gosh, I can't even tell you, Garry, the conversation that she and I had before this whole thing, it's just been so amazing.
Mm-hmm. Well, thank you. I'm just elated to be here with you today. I'm excited. Here we are in the month of February, Black History Month.
Absolutely.
And interestingly enough, when we hit February this year, I thought about all the things that pertain to Black people in particular. Number one is Black History Month. Number two, February 7th was National Black HIV/AIDS Awareness Day. Number three, February is Heart Health Month. Remember my Red Dress Sunday campaign? I was one of the I'm one of the founders. I'm one of the founders of Red Dress Sunday, going back more than a decade ago.
Right.
And so all the other things that happen in the month of February that really impact Black people.
Yeah.
And so it's a need for us to take advantage of that opportunity to talk about health and wealth, because from my vantage point, health is the greatest wealth in our community.
Definitely.
It definitely is. One of the issues that you speak to is Black women's sexual reproductive health.
Yes. As Black women, we truly are the anchors of our community.
Oh, yeah.
And what that means is that if our health is not good, the health of our community is not good.
Yeah.
So when we look at the health disparities, heart health, Black women at the top of the list of heart disease. When we look at HIV, and this was alarming to me a couple years ago, I do work in HIV education and outreach, and when it was brought to my attention, looking at a CDC infographic, an infographic kind of looks like this, those bar charts with the saying, a picture's worth 1,000 words, and Black women, by more than 2 to 1, represent the number one subgroup of new HIV infections among heterosexuals,
Really?
among more than 2
Black
to 1.
women?
Black women. I was like,
We usually think about it like with black men. I don't
well,
know why, but
black same gender loving men are number one off the charts. But in terms of heterosexual, black women,
really?
yes, lead.
And is that, and we're talking sexual health, so that's not necessarily from needle use or anything
No,
like that.
the majority of it is from sexual relations,
Having sex. Yeah,
having
sexual
sex,
relations with
and
people
having.
not knowing. Maybe, excuse me if I'm wrong, but maybe not knowing that they have an HIV thing.
So let's
going
talk
on.
about this. In this month, or late last month, in the news was that Baltimore City was named the number one city in the nation for STI infections, sexually transmitted infections. What's so staggering about that is that we're talking about HIV, and now that there are prevention medications to keep you from contracting HIV,
Oh, wait a minute.
but it doesn't keep you from contracting other
Other things,
Other
right.
things.
sexually transmitted infections.
Right, but okay, can we just dial it back a minute? There are things to keep you from there are preventive measures?
Yes.
I
So
completely and totally did not
you
know
have
that.
there's
Did you
birth
know that?
control to
Yeah.
keep you from getting pregnant.
Yeah,
Well,
There's
yeah.
condoms.
PrEP, which is pre-exposure prophylactic that
Right.
can keep you from contracting HIV. But condoms
Condoms,
should be
prevention.
used in conjunction. You don't have to, but let's be clear. If you're not having courageous conversations with your partner before you commence in
I
the
like
act,
that.
if you aren't having those courageous conversations when you're fully dressed and not thinking with
I love
And
that
thinking
term,
with your
courageous
brain.
libido, you're thinking with your brain.
Yeah.
Courageous conversations.
Yes.
I love that
Then
term.
you want to know what's your status.
Wow.
Why not make, when you decide you're going to go down that road, hey, let's go get tested together.
True.
And
Wow.
truth be told, you cannot get a prescription for PrEP if you've not been tested, because if you are HIV positive, PrEP is not necessarily the treatment.
Right.
For
'cause
you.
It's PrEP. It's
Well,
Before,
it's pre-exposure.
it's pre-exposure.
Now, I will
Yeah,
tell
yeah.
you, there are some that are using PrEP for those with HIV, but that's because you're in treatment, you're in care. And so your care providers are going to know what's the best antiretroviral regimen that you should be on.
Right.
But if you've not been tested, you don't know. And so I love the fact that you can't get PrEP unless you know your status.
And the being, to back it up, as you were saying, PrEP is for the person who believes that they're HIV negative.
Well, you must be.
Right.
You can't get it if you test positive.
Right. So say your partner is HIV positive, or you're not sure what your partner is, but you know what you are. And if you're negative, then you should be doing PrEP. That will prevent you from getting HIV. However, that still doesn't take Baltimore out the number one
No, it
spot
doesn't.
for the the sexually sexually transmitted infections, STIs now, no longer STD. We changed to
Right.
STI.
Yes, it's
Wait,
infections.
whoa. When did it change and why? To
Well, it
STI?
changed a few years ago. I can't tell you why, but what I will tell you is this, that I believe in changing the language from disease to infection is a softer way. And some of those
Okay,
sexually
I hear that.
transmitted infections
That's a
have
good thing.
cures,
Yeah.
but all of them don't. So,
Wow.
newsflash, HIV is not the only sexually transmitted infection without a cure. Herpes doesn't have a cure.
right.
Wow.
The human papilloma virus doesn't have a
Have a
cure.
cure.
They're sexually transmitted infections.
Wow.
Yet, HIV is the one that has the highest stigma
Yes.
associated to
Indeed,
it.
indeed,
And that
indeed.
goes into what creates the largest amount of stigma that people associate it with homosexuality.
Indeed.
But sex is sex. When you close the door, it doesn't matter whether you're man to man, woman to man, trans person to trans
Right,
person.
exactly.
You're still engaging in the exchange of bodily fluids,
Yes.
thereby making you susceptible
Wow.
to HIV.
Wow.
So you better wear a condom, and you should use
And the
PrEP.
condom without a hole in it.
Oh yeah, definitely.
I'm just saying. I
Yeah.
mean, we had a show a couple weeks ago about that. Yeah.
But when you talk about reproductive health, you can't reproduce with a condom. And so this
True.
goes back to the courageous conversations. It goes back to life planning. You know, I've always been a big proponent of Planned Parenthood, but we know that's more a wish list, an ideal.
It's gotten a stigma over the years.
And stuff happens.
Well, all the time. But this is why if you have these courageous conversations before you get to the bedroom, then, you know, you are better prepared to, number one, protect your reproductive health. So let's be clear. HIV can be contracted before pregnancy, during pregnancy, and after pregnancy.
Really?
Really.
During pregnancy? Wow.
If you're
Well,
having
if
sex,
you're having
then-
sex and you're not practicing safe sex,
Wow. Okay.
because you figured I'm pregnant, so I don't have to use a condom.
I don't have to use a
Because
condom. I can't get pregnant.
Oh man. Oh wow.
This is why education
I
is so
never thought
important.
about that. Oh, absolutely.
And outreach.
Jeez.
And, you know, I'm ecstatic because they're wonderful tools. So our organization, NOBCO, we partnered with an internationally award-winning film short. It is by far the best film I've ever seen about HIV.
Really?
Yes, we're gearing up to go on a national tour with this film. We've tested it out. We created a program.
How long is it? Maybe we can show it.
It's 20 minutes.
Oh my gosh, that
It's
would be a
20 minutes,
special
and it is
on
phenomenal.
Urban Health Beat. Yeah.
Maybe so that we could really do a Q&A afterwards, because
sure,
what
sure.
happens is we do the film and then we have real talk.
Yes.
Taking people's questions, dispelling their myths, educating them, informing them that HIV is not the death sentence that
It used to be.
that it used to be, that you can live and live a very good life being HIV positive.
Wow. Well, now I see kind of why you were talking to me about women's reproductive health. Because honestly, I never even thought about anybody getting HIV when they were pregnant. Right? Did you? Have you?
Yeah. I mean,
Well,
have I ever what? Thought about it?
I was just saying, yeah, I mean, is that, I don't know that that's a conversation anybody would have, but this is really, really powerful information because women need to know this. We all need to know this, you know, that,
We all
And women are the, you're saying that black women are the number one or fastest
another
growing.
thing.
Well, the highest
Population.
number
Well,
of new
infections.
infections among subgroups outside of same gender loving men.
Okay. All right. So now, if we want to find more information about this topic, what do we do? Where do we go?
Well, you can begin with reaching out to us, NOBCO.
NOBCO? Okay.
At
All right.
nobco.org.
I got that.
Our
Mhm.
website.
We'll put it on our site.
Yes,
Mhm.
put it on your site. Go there. They can certainly reach out to us. And follow us on social media, because whenever we're doing one of our programs, we have screened the film at the Congressional Black Caucus Foundation
Oh, really?
Annual Legislative Conference. We have screened the film at AIDS United, at AIDS Watch. We have screened the
really?
film at the CDC's HIV Prevention Conference.
We need to be on this list because I need to be
Well-
at these places.
Well, you know,
Well, where's the next screening?
well, the next screening is actually going to be March 10th, which is National Women and Girls HIV/AIDS Awareness Day, and we're doing the screening in D.C. So I will certainly share the information with you.
Yeah.
That would be
Just
great.
down the road, please come and
He'll
be a
try.
part of the talk back session. And we're doing it with a focus. So we created this, and we
Really?
have gone around the country and taken the film as part. We do it in the faith community. We do it anywhere where, and we did it at a church in Detroit.
Did I see
And
this film?
yes,
At the Links thing.
we
Oh.
did a screening at the Links
Yeah,
Assembly
yeah.
in 2018 in
Yeah, yeah, yeah.
Indianapolis.
It's amazing.
And so,
It
in
is
fact, we did a
amazing.
national webinar with the Links
It's
Incorporated,
amazing.
and we had over 200 women engaged on
Wow.
that webinar for 90 minutes, asking
great.
questions, taking information, learning about what is it, why should we know about this, and of course, the Links being a organization of friendship and service, we do a lot of community service
With African American
with
women.
African American community.
Community,
But this is
absolutely.
one going back to why women. So the fact that more black women are walking
Mm-hmm.
around with HIV, the highest number of new infections,
And maybe not
we're
knowing
not
it.
talking about it.
And not talking about it, and maybe not knowing it.
Why aren't we talking about it? What do you think?
Stigma. Stigma, number one. We have been a part of the Howard University's International Stigma Conference that goes on every year in November. And
Oh, really?
Mhm, right in D.C., yeah. So that it's not, there's a dearth of information out there, but if it's something you don't want to talk about because you don't want to own the
Open that up.
probability
Yeah.
that you could be suspect, which is why our numbers are growing.
Yeah.
I can't think of any other reason. I mean,
It's the silence.
if we talk about it, if we acknowledge that it's real, that the numbers are too high, which is why I was ecstatic when Health and Human Services announced, oh, we're taking a bold initiative to end the HIV epidemic by 2023 or something like that. And
Sounds good.
sounds good. But if you look at the cuts they're making to Medicaid, the
Sure.
cuts to federally qualified health centers, the places where Black, brown, and poor women go for reproductive health. And it's reproductive health because most of them are childbearing years, which is why they want to go. It's affordable. And so when you
Yes.
look at the assault on affordable and accessible health care,
Sure.
so to me, that's a direct effect, a direct detriment to the Black community. Because if Black women can't get health care that they can afford and get the reproductive support, whether it's
Support. Right. Exactly.
prevention or termination of pregnancies. I think it goes back to Roe v. Wade, a woman's right to choose. And when you look at what's happening
Yes.
with the assault,
We have to have it.
that other people are going to dictate and determine what you can do with your body.
Absolutely.
Well,
Absolutely.
it makes me think of, though, you talked about stigma, and I'm sitting here and I'm thinking, well, not that I'm a woman, but in a woman's place, but now a woman would have to look at a partner and say, we have to go get tested. The partner, the man, would have to agree.
I ain't
with
going to
that.
go get no test.
Exactly.
Look, you got something?
But go ahead.
Well, yeah, we are
The
saying the
partner,
man. No, we're saying the man.
Well-
because we're talking heterosexual sex.
Heterosexual. It's
okay.
So
women.
we're
Yeah,
saying
Black
the
women.
man. And now, like, I'm not getting tested. I'm not wearing a condom. I don't have anything. Trust me, baby.
Right. Hello.
Right?
Oh,
And
yeah.
So there's your. I mean, because a woman has a right to choose.
Yes.
The right to choose to have AIDS or not to have AIDS.
Well, let's
Well,
back
wait
it
a
up.
minute.
Wait,
Nobody's gonna
let's
choose to
back it
have
up. We're
AIDS.
not choosing to have AIDS. We're
I was gonna
choosing
say.
HIV, which
Yeah.
you can't get AIDS before contracting HIV.
So the right to choose.
But
that.
but it's the right to choose, and so we have to have more sessions on this because
We do.
the number
We
one
do.
reason that stops women from having courageous conversations is fear of missing out. The FOMO.
So
I don't
love
want to
that
miss
term.
out having a love interest, a relationship. I don't want him to go to somebody
Somebody
else
else,
who's
yeah.
easy. Let him go, baby. Let him go. Choose life.
The
Yeah,
FOMO.
you got the right to choose.
Choose life.
FOMO.
You know,
Wow.
if you really want to get with me, then this is a small thing to do. It's a simple finger prick, and a matter of minutes, bam. Okay, I'm good. Now that provided you weren't with someone last night is not
right.
showing up, but it begins the process of understanding, and I call them courageous conversations.
That's why I love that
because they're
term,
esteem
courageous,
issues, they're
yes,
self-esteem and
absolutely,
self-worth issues.
absolutely,
And I think that as Black
absolutely.
women, we get beat up enough
Absolutely.
that now you want me to go to my man and, let's be clear. Man sharing is pseudo acceptable in our community. It really is. Come on.
Yeah, true. Sort of.
I know he got
I
that other
think.
woman.
I don't know anything,
Long-
well, see, I don't know anything about that. My wife told me she's a pathologist that she'd kill me and they'd never know how
Yeah, well.
it was done.
Yeah,
That's
I,
right.
no,
I don't know about this.
I'm
Yes,
not really
but-
good with sharing. I'm an only child, but I'm just saying.
But the point is, wait. I'm not saying we're willingly sharing.
Yeah.
But whether or not, but I hear you. No, I hear you. No, I completely understand.
And
You're
Black
fun, but-
women have more
sharing
sex
whether or not
with
we
Black
know.
men
Yes, yes,
in our
yes.
community. So let's look
Yes.
at the other social ills.
Yeah.
Incarceration rates,
Yeah.
drug addictions, all those disparities and social ills that we bear the brunt of. Who's to say that they wouldn't be passed over?
Absolutely.
into our intimate
generations. It's generations. I mean, they're generational curses, as I'm sure that.
Well, it's
do
the
you think?
reality. I don't know if they're curses. It's the reality.
Okay.
And I think that when you've been beat up and beat down so much, everybody's looking for a little joy some kind of way. And, People
Yeah.
like having sex. Well, I'm just saying, have safe sex.
Yeah.
Have safe sex.
Because you could be on PrEP, you get another STI because you're not using condoms, and what happens? All of a sudden, well, I was taking PrEP, how'd I get HIV? Well, you got syphilis.
Well, I just want to make sure what this PrEP thing is. What is the PrEP thing?
It's a pre-exposure prophylaxis. So for women, now
okay, it
interestingly
says
enough,
PrEP.
when
Okay.
PrEP came on the scene
Okay, it's
in
an acronym.
2010, 2012, it was basically given to same-gender loving men. And you notice
Okay.
the language I'm using because
do.
that is the preferred language.
Absolutely.
Versus
absolutely.
MSM, which the CDC still refers to it, men having sex with men.
Right, absolutely. We can do that. Mhm.
People, it was with men that they were focused on, and no one looked at women. Well, from day one, women could have been included, but that wasn't the focus. And so a man can take PrEP and be covered in like 2 weeks. A woman, just like birth control pills, needs to be on PrEP for a month
Wow.
to make sure, well, it's got to be in your system. Well,
Right,
look,
it's gotta
when
get in
you
your
start
system.
birth
Right,
control
right,
pills,
right.
what's the doctor tell you?
A month.
You're not covered until after 30 days. When you get in your second pack, then you're good. But until then, use a condom.
Right.
And so it's beyond just avoiding pregnancy, but it's about choosing life,
It's true.
infection-free.
Infection-free. I like that also.
And PrEP is just for,
I'm
for our
telling you.
listeners, PrEP is
Courageous
just,
conversations.
And there's also PEP.
infection-free. Courageous conversations lead to infection-free.
Or minimization.
and you still got to use the condom for the other STIs.
That's right.
So
That's
unless you're
right.
planning on having a child, you still have to use that condom.
That's right.
Yeah.
And PrEP is, what percentage is it effective?
For women, it's 92%. If it's a pill you take once a day, but you need to take it every day, like your birth control pill.
Right.
You know that if you're on the birth control pill and you miss a couple days because you forgot, you need to be using some other alternative methods of protection. PrEP is the same way. You've got to adhere to it like you do a birth control pill.
So it's not 100%.
No. But
It's
what
92.
is?
Well, yeah.
Maybe
But
PrEP
then there's
and
that.
a condom.
PrEP and a condom, but if the condom breaks, but
I thought
what I'm saying is
PrEP was
you're
part of the condom.
you're still far better off in terms of preserving your reproductive health
Yeah,
in
Yes.
using both.
Yes.
definitely.
Yes. So I really, really, really want to be clear about the whole STI and STD thing, okay? Because honestly, this is the first time I've heard of STI. I guess it's not your
Well,
first
I'm in the
time.
business.
Right.
So, yeah.
Well,
I
yeah,
do
yeah.
the work, and
Yeah,
anything
yeah, I mean, I'm
that
just saying,
lessens.
I mean, I hear of STDs, but I just don't want people to misconstrue the dynamics of these, because some kids will be like, oh, I'm not going to get an STD, but it's okay if I get an STI.
No, they're
I just
one
wanna
and the
ma-
same.
They are one,
They're
and,
one
the
and the
same.
same.
And that's why I really, really, really wanted to be clear, because, yeah,
So if I had to speculate, I would say the shift from STD to STI was to lessen the impact. If to have a disease is I just have an infection. I don't have a disease.
yeah. But it's important to say that it's one and the same, right?
Yeah.
Yeah, very
Right.
much so.
Have you seen people in your practice?
Well, I have a lot of
Garry?
patients that have that are HIV positive.
Oh, really?
Because HIV
It's
is
a painful
associated
thing,
with
too.
a lot of pain. They get neuropathies from the HIV virus attacking the nerves, so they get
But
burning pain. things like
diabetics
that.
will get neuropathy when they don't take care of themselves.
And HIV patients will too.
Yeah.
So it's a
Yeah.
painful disease.
Wow.
At the end of the day, it speaks to health care.
It
And
does.
that, I say to
Absolutely.
people think because I have natural hair, I don't have to do anything with my hair. If you have hair, you must care for it.
Yeah.
If you
Good
want,
point.
if you have hair and
Good
you want to
point.
keep it, you care for it.
Excellent point. That's right. No matter what. I mean, they say natural hair, but no, you
Well,
gotta still
yeah.
do it.
You
And
still
if you
have
want
to
hair,
right.
you have to care
You have
for
to
it.
care for it.
Otherwise, it'll fall out.
That's right.
Well, and by the way, when was the last time you got a haircut, Dr. Jennings?
I went to your
It's
person.
looking like no. I'm just saying.
It's winter time. I keep it long in the winter.
Oh, you keep it long in the winter. Oh, okay.
That's a smart man.
Well, yeah. Well, okay. Well, that's debatable.
But I will tell you, this is a wonderful brochure. It's called
Absolutely.
Black Women and HIV, and it talks about all sorts of ways. It's a cute brochure that gives you all sorts of Q&A, question and answers. HIV in Black women, how is it transmitted? What activities do not transmit HIV?
I have never seen a brochure like that.
Masturbating, kissing, touching your partner's genitals. No, you can't get HIV that way.
Okay.
You get it through blood, semen, vaginal fluids, rectal fluids, breast milk. Did you know that?
Absolutely not.
Yeah. This is good stuff. How does HIV relate to my reproductive health? Where can I get a test? What should I expect? This is just good, basic information to
Nobody
know.
has.
And
I
as I
cannot
say,
remember ever seeing
information
that.
is powerful, but only if you use it.
I cannot remember
So
ever
where
seeing
can our listeners
information
get
like
one of
that.
those?
Well, you can contact me. I'd love to have some, to have them left here.
Be good.
That for people to take, and we print them. They were produced by the Black AIDS Institute. I'm glad I have the copy to get reprinted because I went on their website to find them and couldn't anymore. And so I'm like, well, that's all right. I have it. I'm gonna keep using it because the information is still valid. And on the back, there are additional resources you can go to for information. But I think mothers should be talking to their daughters about this.
Absolutely, absolutely.
It's not valid to say no one ever told me.
That's
Or
the
I
truth.
didn't know. There's
You didn't know? Now you know.
Now you know. Now you know.
When you know
Says
better,
Biggie.
you do better, isn't it?
That's
Or
right.
at least you're supposed to.
You're going to have to come back because I know there's so many more topics that we need to talk about. In terms of our conversation, we want to talk about maternal health, reproductive rights,
Yeah. They're under assault
which
right
I think, I think we can touch on that now.
Yeah. So, let's be clear. When you look at the number of states in the last year that are looking to push the Supreme Court
Yes.
to overturn Roe v. Wade, when you look at the budget cuts that are taking place to Medicaid, I mean, they're slowly, when you look at the appointments of federal judges, that when people challenge the assault on taking away a woman's right to choose. Now, it's always been that issue. Well, they shouldn't go to the doctor's office and make it the place for carelessness that you terminate every pregnancy. It is so much more than that.
Much more.
It is so much. When you talk about sexual violence, when you talk about human trafficking, there are all these ways that women are under attack. And it begins with,
And they can be
it begins with representation. And so I'm just going to say this because I have to. One of the things that is really disturbing to me right now is when I look at the lack of women whose voices are in leadership position to see that these rights aren't lost, to see that there's a focus on what it means to provide affordable and accessible health care. And so I'm just very dismayed that in the state of Maryland, a state that touts itself on the moderate to progressive end, that at the federal level, there are no women representing us.
Not since my days with Senator Mikulski. Yeah.
When Senator Mikulski left, and then when Congresswoman Edwards lost her seat, we have been without female representation in Congress.
Pretty much.
And so when you think about, yet I know for a fact, more black women register to vote, and more black women vote.
Absolutely.
I'm just curious, what interest are we voting for if we don't have representation that looks like us?
Absolutely. And so, as you and I spoke, we were talking about our congressional races, our state races. And I think that speaks to your point. We have a couple of women running in the 7th Congressional District.
Yes, we do. Yes, we do.
So, that speaks to your point. Why are you looking at me like that?
I'm listening.
Well, I just think it's important. And I think it's important to look at, we won't have diversity and inclusion of representation
Well, yeah.
until we decide that it's needed. And when you look at the issues and what's at stake, I think it's needed now more than ever.
Well, it's true. And diversity comes, we did a really, really, really good job in the Congress, you have to say, right?
as a nation, but all politics are local, and it
Yeah,
begins
yeah,
at
yeah.
home.
And that's where we are right
And that's
now.
where we are.
That's
We're at
where we are.
home.
That's
and
where we are.
how can I say to anyone that I work with on a national level, oh, Maryland's a very progressive state? No, we're not as progressive.
We're still Southern.
We talk the talk, we don't walk the walk. How about that?
We are still Southern. We're still a Southern state, right?
Whatever, we still like to believe that we're moderate, leaning towards progressive.
Absolutely. Absolutely. All right. So where do we get in touch with you?
You get in touch with me. You can find me at www.drhelenholton.com. And you can find me at www.nobco.org. And that's DR for doctor, DRHELEN,
Yeah.
HOLTON.com.
Yeah. I was wondering about the DR.
The DR?
The DR. I wanted to. Yeah.
It's just DR. Don't spell out
DR.
doctor. That's
Okay,
way
okay.
too long.
But anyway, thank you.
wouldn't-
You are
wouldn't
going to
fit
be a
on a
regular
card,
on this show because we have so much more to talk about.
Yeah.
What did you say?
I said all that wouldn't fit on a card.
I'm telling you.
Okay. We're not going to talk about cards with Dr. Jennings. So, thank you so much, Helen. I can
Thank
call you
you.
Helen.
Yes, you can.
Former city councilwoman, PhD. I mean, she is just like the most brilliant woman that I have ever met. And I'm so proud of you. And I'm so proud to call you friend.
Oh,
I really,
likewise,
really am.
likewise. I know it's Baltimore.
I know.
That's what
Yeah.
happens.
Baltimore, it is. So, okay, so Helen, so we need to say that laughter is the best medicine. And so I have one, maybe two. All right. So, what do you lose when you stand up?
I don't know what.
What do you lose when you stand up?
Your lap.
Okay.
Okay, see, I think that's funny.
Where do you get these from?
I don't know. You lose your lap.
You lose your lap. I mean, that's
Okay.
true, right? Right. Okay, so, I mean, and you know this one, so you don't answer, Dr. Jennings. When you lose your appendix, it's called an appendicitis. And when you lose your tonsils, it's called a tonsillectomy. What happens when you have a growth on your head? What's it called?
A lobotomy.
Oh, like that. No, it's called a haircut.
Okay.
But a lobotomy was really,
I
really
don't
good.
know.
If you think the jokes are funny, maybe you had one. No.
You've been listening to Urban Health Beat 2.0, the podcast. I'm your host, Marilyn Harris Davis.
And I'm Dr. Garry Jennings.
And until next time, remember, your good health is a work in progress.
So
work
work
it.